2020 Coronavirus Outbreak in Europe. This article documents countries in Europe affected by responses to the coronavirus responsible for the 2019-20 outbreak in Wuhan, China, and may not include all the contemporary major responses and measures. Confirmed cases. Austria. On 25th of February, Austria confirmed the first 2 cases of COVID-19. A 24-year-old man and a 24-year-old woman from Lombardy tested positive and were treated at a hospital in Innsbruck, Tyrol. Belgium. Belgian nationals living in Hubei were repatriated on a series of evacuation flights arriving in Belgium on 1st of February, where everyone repatriated were quarantined and examined in a military hospital. Infected people were transferred to a specialized hospital. Non-essential flights to China, Hong Kong excluded, were highly advised against, with some travel companies canceling all flights to China. Chinese New Year celebrations were cancelled at the University of Leuven. On 4th of February, Belgium confirmed the first case of COVID-19. The patient, an asymptomatic 54-year-old male, was one of 9 Belgians repatriated from China. All of them were quarantined at Saint-Pierre Hospital in Brussels. Croatia. On 25th of February, Croatia confirmed the first case of COVID-19. A 26-year-old man had stayed in Milan, Italy from 19 to 21 February, tested positive for SARS-CoV-2 and was hospitalized at University Hospital for Infectious Diseases Dr. Fran Mihaljevic, Zagreb, Croatia. On 26th of February, 2 new cases were confirmed. The second case involved the twin brother of the individual on the first case. He was also admitted to University Hospital for Infectious Diseases Dr. Fran Mihaljevic. The third case involved a Croatian man who worked in Parma, Italy. He was hospitalized in Rijeka. Denmark. Denmark confirmed their first case on 27th of February when a man from Ruskula tested positive for the virus. The patient was an editor from TV2 that had been skiing in Italy and returned to Denmark on 24th of February. He had minor symptoms of the disease and was put in home quarantine. Estonia. As of 26th of February, 2 people were quarantined in 2 hospitals in Estonia, one of them in Pärnu. On 27th of February, the Estonian Minister of Health Tanel Kiik announced the first confirmed coronavirus case, an Iranian citizen who arrived to Tallinn, Estonia by bus via Riga, Latvia, and who had originally departed from Iran. Finland. On 27th of January, Finland's foreign ministry advised citizens to avoid unnecessary travel to Hubei province. The following day, the Finnish airline Finnair announced it was suspending 5 weekly routes to Nanjing and Beijing-Daxing until the end of March. On 28th of January, Finland confirmed the first case of COVID-19. A 32-year-old Chinese woman from Wuhan sought medical attention in Ivalo and tested positive for SARS-CoV-2. She had traveled from Wuhan. She was quarantined at Lapland Central Hospital in Rovaniemi. The woman recovered and was discharged on 5th of February after testing negative on 2 consecutive days. On 30th of January, Finland's health officials estimated that up to 24 people had been exposed to the virus. By 5th of February, 3 of the potentially exposed individuals were known to have left the country, and 14 of the remaining 21 had been placed in quarantine and were expected to be released over the following weekend. On 26th of February, Finland's health officials confirmed the second case, a Finnish woman, who made a trip to Milan and was back in Finland on 22nd of February, tested positive at the Helsinki University Central Hospital. France. COVID-19 outbreak in France was divided into 2 phases. First confirmed cases originated from China and Singapore, from January 24, 2020, first case in Europe in Bordeaux, and a local cluster in Haute-Savoie, to 24th of February where the last hospitalized was out of hospital. 1 day later on 25th of February, a second wave of imported cases from Italy has begun. 2 people died in France, a Chinese tourist of 80 years, first death in Europe, on 14th of February, and a French professor of 60 years old from Picardy on 26th of February, without it being known how he was infected. Germany. On 27th of January, the first COVID-19 case was confirmed in Germany. The majority of the COVID-19 cases in January and early February originated from Webasto headquarters in Bavaria. A total of 14 employees and family members tested positive and were treated at München Hospital in Schwabing. On 25 and 26 of February, following the COVID-19 outbreak in Italy, 3 people tested positive and were hospitalized in Göppingen and Tübingen. Multiple new cases, which were not related to the Italian clusters, occurred in multiple regions including Baden-Württemberg, North Rhine-Westphalia and Rhineland-Palatinate. As of 26 February, Germany had a total of 27 confirmed cases, 14 of them had since recovered. Greece. As of 25 February, 4 suspected cases from Italy were reported in the port of Treas. Another suspected case was reported in the Icon hospital. On 26 February, following the COVID-19 outbreak in Italy, the first case in Greece was confirmed. A 38-year-old woman from Thessaloniki, who recently visited northern Italy, tested positive and was admitted to the Ahepa University Hospital. Her family, as well as those who came into contact with her, voluntarily isolated themselves. Following the confirmation of the first case in Greece, 105th Primary School of Thessaloniki, where the patient's daughter went to school, was closed until 27 February. Italy. On 31 January, 2 cases were confirmed in Rome. They were 2 Chinese tourists who arrived in Milan on 23 January via Milan Malpensa Airport and traveled to Rome on a tourist bus. Italian government on the same date suspended all flights to and from China. Prime Minister Giuseppe Conte said Italy is the first EU country to take this precautionary measure. On 6 February, one of the Italians repatriated from Wuhan, China tested positive for COVID-19, bringing the total number of cases in Italy to 3. On 22 February, the repatriated Italian recovered and was discharged from the hospital. On 22 and 26 February, the 2 Chinese tourists tested negative for COVID-19 at Lazzaro Spallanzani National Institute for Infectious Diseases in Rome. A cluster of COVID-19 cases was later detected, starting with 16 confirmed cases in Lombardy on 21 February, an additional 60 cases on 22 February, and Italy's first deaths reported on the same day. As of February 26, 2020, there were 12 deaths and 470 confirmed cases in Italy. As of late February, Italy was hit harder than anywhere else in the EU by the COVID-19 outbreak. North Macedonia. On 26 February, North Macedonia confirmed the first case of COVID-19, a woman who tested positive for SARS-CoV-2 in Clinic for Infectious Diseases, Skopje. She stayed in Italy for a month and had been sick for 2 weeks. Upon returning to North Macedonia, she immediately reported to the clinic. Norway. On 26 February, Norway confirmed the first case of COVID-19. The Norway Institute of Public Health announced that someone tested positive for SARS-CoV-2 after returning from China the previous week. The person was asymptomatic and in good health. Romania. On 22 January, following the COVID-19 outbreak in China, the Romanian government announced several preventive measures, including designation of 5 hospitals as isolation centers for new cases, purchase and placement of thermal scanners in international airports, and special designated lines for passengers coming from areas affected by COVID-19 outbreak. On 21 February, following the COVID-19 outbreak in Italy, the Romanian government announced a 14-day quarantine for citizens returning from the affected regions. A woman returning from Lombardy to Buzău called the emergency number after a co-worker was hospitalized with flu symptoms, and as of 24 February was at a quarantine center near Buzău. On 26 February, Romania confirmed the first case of COVID-19, a man from Pregoria, Gorj tested positive for SARS-CoV-2, after coming in contact with an 71-year-old Italian man from Cattolica, Italy. The Italian man visited his wife's family and had several business meetings in Romania on 18 to 22 February. The Romanian man was admitted to National Institute of Infectious Diseases Professor Dr. Matei Bals in Bucharest. Russia. The Russian consumer health watchdog Rospotrebnadzor advised tourists to refrain from visiting Wuhan and stay away from Chinese zoos and markets selling animals and seafood. The agency also said that development of a vaccine against the virus was underway, relying on the WHO's recommendations. The Russian city of Blagoveshchensk, near the Chinese border, limited access to the country. Cultural exchange and official visits to China were cancelled. The governors of the Amur region Vasily Orlov, and of the Penza Oblast Ivan Blazartsev, called on residents to abandon trips to China altogether. Residents of large cities have been told to avoid contact with tourists from China. On 31 January, 2 cases were confirmed, one in Tyumen Oblast, another in Zabaikalsky Krai. Both were Chinese nationals. On 13 February, police arrested a woman who breached quarantine protocols after being airlifted out of China and tested negative for the virus. On 26 February, 3 cases were positive for coronavirus from persons at quarantine arrived from Diamond Princess in Kazan, Tatarstan, Spain. On 31 January, the first case in Spain, a German patient, was confirmed on the Canary island of La Gomera. On 9 February, the second case was found to be a British man in Palma. On 24 February, a medical doctor from Lombardy, Italy who was vacationing in Tenerife, tested positive at the University Hospital of the Nuestra Señora de Candelaria in Spain. Sweden. On 31 January, Sweden confirmed the first case of COVID-19. A woman in her 20s, who visited Wuhan, tested positive for SARS-CoV-2 and was admitted at Ryhof County Hospital in Jönköping. On 26 February, following the COVID-19 outbreak in Italy, a 30-year-old man, who previously visited northern Italy, fell ill 3 days after returning to Sweden. He tested positive and was admitted to Sahlgrenska University Hospital in Gothenburg. Switzerland. On 25 February, Switzerland confirmed the first case of COVID-19, a 70-year-old man in the Italian-speaking canton of Ticino bordering Italy, who had previously visited Milan tested positive for SARS-CoV-2. United Kingdom. On 31 January, first 2 cases were confirmed in England, both members of a family of Chinese nationals staying in a hotel in York who were taken to specialist facilities in Newcastle upon Tyne. On 23 February, the Department of Health and Social Care confirmed a total of 13 cases. Suspected cases. Andorra. As of 26 February, an Andorran woman returning from Italy with influenza symptoms was quarantined in a hospital, with results pending. Bosnia and Herzegovina. As of 25 February, 11 people were under surveillance as suspected cases. In Sarajevo, 3 Chinese tourists that were showing symptoms were tested negative for the virus. Poland. Warsaw Chopin Airport has made special surveys for passengers arriving from China. As of 19 February, 12 people remained hospitalized in connection with the coronavirus, 13 were under home quarantine and 1,000 were being monitored by health services. Prevention in other countries. Andorra. The government of Andorra has developed an action protocol, which has been distributed to all health professionals in the Principality. Likewise, calls those who plan to travel to China or have traveled there to notify the authorities. Czech Republic. On 25 February, Prague International Airport introduced special arrival gates for selective screening of passengers arriving on flights from Italy. Iceland. Passengers at the Keflavik International Airport are being notified that both passengers with signs of respiratory infection and asymptomatic individuals who had been either in Wuhan for the past 14 days or have been in contact with individuals with suspected or confirmed 2019 nCoV infection that they must be medically assessed at the airport for possible further measures including being placed under quarantine. The Directorate of Health has decided against screening all incoming passengers for temperature due to high cost and was found to be ineffective in dealing with outbreaks. Latvia. Starting from 28 January, Riga International Airport started investigating travelers from Wuhan. Lithuania. From 25 January, National Public Health Center specialists were consulting travelers from and to China at all 3 airports in Lithuania. According to public health officials, Vilnius Airport had a medical exercise in December and is ready to handle infected passengers and contain the spread of the virus. On 26 February, Lithuania declared a state emergency as a preventive measure against the spread of the coronavirus. Malta. On 24 January, the Superintendent of Public Health predicted low exposure due to no direct flights between Malta and China. On 24 February, the health authorities announced that all passengers arriving in Malta were screened by thermal cameras. 2 thermal scanning devices were installed in Malta International Airport. Passengers disembarking from vessels at the Grand Harbour and Catamaran Terminal in Marsa were also scanned. At Mater Dei Hospital, all patients with respiratory symptoms were checked for COVID-19. On 25 February, the Ministry of Health recommended travelers coming from Italy to self-quarantine for 14 days and for all citizens not to travel to regions of Italy affected by the outbreak. As the Italy coronavirus outbreak proceeded south with the first case discovered in Palermo, panic buying ensued and supermarkets were emptied. Maltese chandlers and ship workers refused to board vessels from Italy to unload cargo, unless they were provided supervision and clearance by medical doctors. The Malta Union of Teachers recommended members not to accept any homework from students who were unwell and requested students and teachers who visited countries affected by the virus to stay home. Deloitte Malta requested staff who recently returned from Italy to work from home as well as deferred non-essential travels to Italy. Netherlands. Airlines and the main international airport Schiphol are, as of 22nd of January, not taking extra measures yet against the spread of the virus, stating the lack of direct flights from or to Wuhan. Serbia. Belgrade Nikola Tesla Airport introduced new measures, including thermal cameras. Ukraine. On 4 February 2020, Ukraine International Airlines suspended its charter service to China's Sanya Phoenix International Airport in Hainan. Initially, the suspension was to last until 24 February, although the airline had not yet indicated that it will resume flights. SkyUp, a Ukrainian low-cost charter airline, announced on 27 January that it would also be suspending flights to Sanya, Hainan, until March. On 24 February, Borispol International Airport and Kiev International Airport were supposed to implement thermal screening procedures for travelers from Italy, but the staff were either under-equipped with thermal cameras or ignoring the protocol.